push by Governor Ron DeSantis to bring back the monoclonal antibody treatment, despite its maker and the FDA saying it doesn't work for the widespread Omicron variant.
Plus, a contentious confirmation hearing for Florida Surgeon General Dr. Joseph Ladapo ends with a walkout by the Democrats and an immediate vote by Republicans to recommend him for the position. CBS 4's Karli Barnett joins us live now with more on both of those events.
Karli, an interesting day for Florida in its fight against the virus, to say the least.
Elliot, Lauren, yes, certainly a lot of commotion today around COVID in both its prevention as well as its treatment. DeSantis was at Miami Dade College today calling it, quote, fundamentally wrong that 2 monoclonal antibody treatments commonly used here in Florida would be halted. Now, monoclonal antibodies used at a very limited basis at hospitals here like Jackson Health. And as you mentioned, the state surgeon general also had a confirmation hearing today, but COVID-19 caused controversy.
This was a rash decision.
Governor Ron DeSantis in South Florida Wednesday pushing back against the FDA's decision to revoke emergency authorization for monoclonal antibody treatments made by Regeneron Pharmaceuticals and Eli Lilly.
The Biden administration abruptly canceled the ability to use 2 of the most prominent monoclonal antibody treatments that Florida has used a lot.
The FDA says because data show these treatments are highly unlikely to be active against the Omicron variant, these treatments are not authorized for use in any U.S. states, territories, and jurisdictions at this time. The CDC says 99% of U.S. cases are from Omicron currently, but DeSantis argues people who travel to Florida from other countries could still bring over other variants.
You don't know when somebody comes in necessarily whether they have the Omicron infection or the Delta infection.
The decision meant the closure of all of the monoclonal antibody state sites and limited some doctors.
I was very disheartened having to tell 18 patients that next day that were on the schedule that we could not give them my typical medication, which is Regencov.
Meanwhile, Wednesday, a Senate committee signed off on the confirmation of State Surgeon General Joseph Ladapo. That was after Democrats walked out, saying their questions weren't being answered.
Do the vaccines work against preventing COVID-19? Yes or no?
Yes or no questions are not that easy to find in science.
Ladapo at first did not give a straight answer regarding the effectiveness of vaccines against COVID, being asked 3 times, but did eventually respond.
The Pfizer product and the product that was developed by Moderna have been shown to have relatively high effectiveness for the prevention of hospitalization and death, and over time, relatively low protection from infection.
Now, Ladapo still needs a full Senate vote. He has another interview with a Senate committee before that. As for the state of monoclonal antibodies, here at Jackson Health System, for example, they say they have the monoclonal antibody treatment sotrovimab, but they say since the reserves are very limited, they are keeping that for their most immunocompromised patients or their most serious cases. Live outside of Jackson Memorial Hospital, Karli Barnett, CBS 4 News Tonight.